I am very pleased to have Lucian Leape here, and he is going to introduce himself and discuss disruptive behavior in healthcare.
Thanks, Fred. I'm Lucian Leape. I'm an adjunct professor of health policy at Harvard School of Public Health, and I've been working on the whole issue of preventing medical errors and making healthcare safe for the last 10 or 15 years. The problem of disruptive behavior is really a serious one, and I think we're finally coming to grips with it. We've sort of pretended it wasn't there for a long time, mostly because I think people really didn't know what they could do about it. I personally think it is very serious, and that the whole issue of disrespectful behavior is one of the root causes of our problems in improving safety. There's the problem of the outlandish physician, which you've just read an example of, but beyond that, there are other levels of disrespect that are equally harmful. The humiliating way we often treat nurses or medical students, maybe not shouting and being overtly disruptive, but clearly disrespectful, and it's very damaging to morale, it's very damaging to communication. It cuts us off from one another, and it really is very harmful. So we need to do something about this. I think the causes are very complex. Some of these are just personality problems, but a lot of it is learned behavior. That is, it's things that physicians learn in medical school and in residency from their role models. It's also related a great deal, I think, to the stressful situation people are in. People who otherwise have good control of their emotions can lose it when they are under a lot of stress, and we have managed to create an environment where everybody's under stress. So there's a lot of different causes for it. But the fact of the matter is, it is poisonous to collaboration, it is detrimental to patient safety, and we have to do something about it. My own feeling is it starts at the top. That is, the organization has to have a policy that says we do not tolerate grossly disrespectful behavior, and that if you do this, there are consequences. And unless that's in place, then it is very difficult for anybody in the front line to deal with it. The nurse in the situation can't do anything if the institution doesn't back her up and doesn't back up a policy. So we have to have a policy. I think beyond that, we need to get at the root causes, and that means we need to do a lot to, if you will, rehabilitate these people. Take people who have these problems and teach them to behave properly, and that, of course, should start in medical school. We should start with medical students being taught about the importance of respect, and most of all, they have to have the proper role models. They have to have their teachers be people who model this. So it's a big issue, it's a big order, but it's something, it's time has come to do something about.
Now, Lucian, if a nurse, he or she, encounters particularly disruptive behavior, do you have any recommendations for them what they can do on the spot and immediately afterwards?
On the spot is very difficult because emotions are very high, and the person who's just been humiliated or treated badly is not in a position to do much to the person who's abusing them. Right. So probably the best thing in that situation is to just be quiet and get the situation over with. The important thing, however, is not to let it stop there. That is, this kind of behavior will continue unless something is done about it. Now, if you're in an institution that doesn't want to do anything about it, then that's a problem. But if your institution does indeed have policies and practices, then it's important this kind of behavior be reported and that it go up to the appropriate level to be dealt with. But I think the individual is very hard pressed to do much about it if the leadership hasn't got effective policies. Of course, if they had effective policies, perhaps it wouldn't have happened. So this is a chicken and egg kind of problem, but I think it's very difficult for people in the front line.
Great. Well, I think it's I think the take-home message is every hospital, every health system needs a policy on disruptive
Absolutely.
Behavior.
Absolutely.
Great.
They need more than a policy. They need to have a process so that when something like that happens, it's quite clear what will happen. And that is that it'll be reported, it'll be investigated, the person will be spoken to, mechanisms will be put in place to either have them learn to behave properly or be separated from the institution. An institution cannot survive if it tolerates this kind of behavior.
Lucian, I totally agree, and thank you very much.
My pleasure.